Hello students, today we will talk about diagnosis, pathology, etiology and clinical symptoms of disease second, which includes jaundice, tuberculosis, schizophrenia and Parkinson's infertility. And today's objectives are as follows. First, to know about the symptoms of jaundice. Second, to know the hepatitis A, B and C tests. To get knowledge about tuberculosis and schizophrenia, and to know about biochemical techniques for the detection of jaundice, tuberculosis and Parkinson's infertility. So, first of all, we will discuss about jaundice. Jaundice is a term used to describe a yellowish tint to the skin and sclera, that's the white part of the eye, that's caused by an excess of bilirubin in the blood. Bilirubin is a yellow-colored substance that's responsible for the yellowing of the skin and sclera. Bilirubin is a waste product that remains in the bloodstream after the iron is removed from the hemoglobin, which is released from the degradation of erythrocytes. When there is an excess of bilirubin, it may leak out into the surrounding tissues, saturating them with this yellowish substance. Bilirubin that's just circulating freely in the blood is called unconjugated bilirubin. One of the liver's function is to filter out waste, such as bilirubin, from the blood. Once it's in the liver, other chemicals bolt on to the bilirubin, creating a substance called conjugated bilirubin, which is secreted in bile. That's a digestive juice released by the liver and then excreted. Now the types of jaundice. There are three main types of jaundice. First one is hepatocellular jaundice. This is the type of jaundice that occurs as a result of liver disease or injury. Second is hemolytic jaundice. In this type of jaundice, which occurs as a result of hemolysis, that's an accelerated breakdown of erythrocytes, also called red blood cells, leading to an increase in the production of bilirubin. And the third one is obstructive jaundice. This is a type of jaundice that occurs as a result of an obstruction in the bile duct. That's a system of tubes that carries bile from the liver to the gallbladder and small intestine, which prevents bilirubin from leaving the liver. Jaundice, not to be confused with infant jaundice, is usually a sign of an underlying disorder. Now the symptoms of jaundice. The most persistent sign of jaundice is a yellow tinge to the skin and sclera, that's whites of the eye. This usually starts at the head and spreads down the body. Symptoms of jaundice include yellow tinge to the skin and whites of the eyes, fatigue, weight loss, vomiting and fever. Now the diagnosis of jaundice. Doctors will be feeling for masses, that's tumors in the abdomen, or checking the firmness of the liver. A firm liver indicates cirrhosis, while a rock-hard liver indicates cancer. The severity of jaundice is determined by several tests, the first of which is a liver function test, to find out whether or not the liver is functioning properly. If the cause of your symptoms can't be identified, your doctor may require blood tests to check the levels of bilirubin and evaluate the composition of the blood. Some of these tests include bilirubin test. That's a high level of unconjugated bilirubin relative to the levels of conjugated bilirubin indicate hemolysis, which means accelerated breakdown of erythrocytes. Second, full blood count or complete blood count CBC, which measures the levels of erythrocytes, also called red blood cells, leukocytes, means white blood cells, and thrombocytes, which is also called platelets. Now the hepatitis A, B and C test. If an obstruction of the liver is suspected, the liver structure will be looked with the help of imaging tests. Some of these tests include magnetic resonance imaging, that's MRI, abdominal ultrasonography, that's ultrasound, computerized tomography, which means CT scan, or computerized axial tomography, means CAT scan, and endoscopy retrograde cholangiopancreatography, which means ERCP. A liver biopsy is particularly useful in checking for inflammation, cirrhosis, cancer, and fatty liver. This test involves injecting a needle through the skin and into the liver to obtain a sample of the tissue, which is examined under a microscope. Now moving to the another disease, that is tuberculosis. Tuberculosis, or TB, is an infectious disease caused by the bacterium called Mycobacterium tuberculosis. Tuberculosis generally affects the lungs but can also affect other parts of the body. Most infections do not have symptoms known as latent tuberculosis. About 10% of latent infections progress to active disease, which if left untreated kills about half of those infected. The classic symptoms of active TB are a chronic cough with blood containing sputum, fever, night sweats, and weight loss. Symptoms of TB disease depend on where in the body the TB bacteria are growing. TB bacteria usually grow in the lungs, called as pulmonary TB. TB disease in the lungs may cause symptoms such as a bad cough that lasts 3 weeks or longer, pain in the chest, coughing up blood or sputum. Now, the other symptoms of TB diseases are weakness or fatigue, weight loss, fever, sweating at night. Symptoms of TB disease in other parts of the body depend on the area affected and spreads through inhalation of infected air containing bacteria. People who have latent TB infection do not feel sick, do not have any symptoms, and can't spread TB to others. Now, the diagnosis of active tuberculosis. Diagnosing active tuberculosis based only on signs and symptoms is difficult, as is diagnosing the disease in those who are immunosuppressed. A diagnosis of TB should, however, be considered in those with signs of lung disease or constitutional symptoms lasting longer than 2 weeks. A chest X-ray and multiple sputum cultures for acid-fast bacilli are typically part of the initial evaluation. Interferon gamma release assays and tuberculin skin tests are of little use in the developing world. Latent tuberculosis, in which the Mantoux tuberculin skin test is often used to screen people at high risk for TB. Those who have been previously immunized may have a false positive test result. The test may be falsely negative in those with sarcoidosis, Hodgkin's lymphoma, malnutrition, and most notably active tuberculosis. Interferon gamma release assays on a blood sample are recommended in those who are positive to the Mantoux test. These are not affected by immunization or most environmental mycobacteria, so they generate fewer false positive results. IGRAs may increase sensitivity when used in addition to the skin test, but may less sensitive than the skin test when used alone. Now moving to the another disease, which is schizophrenia. Schizophrenia is a serious disorder which affects how a person thinks, feels, and acts. Someone with schizophrenia may have a difficulty in distinguishing between what's real and what's imaginary, may be unresponsive or withdrawn, and may have difficulty expressing normal emotions in social situations. Contrary to public perception, schizophrenia is not split personality or multiple personality. The vast majority of people with schizophrenia are not violent and do not pose a danger to others. Schizophrenia is not caused by childhood experiences, poor parenting, or lack of willpower, nor are the symptoms identical for each person. The cause of schizophrenia is still unclear. Some theories about the cause of this disease include genetics, which means heredity, biological abnormalities in the brain's chemistry or the structure, or possible viral infections and immune disorders. Now, the signs of schizophrenia. The signs of schizophrenia are different for everyone. Symptoms may develop slowly over months or years, or may appear very abruptly. The disease may come and go in cycles of relapse and remission. Behaviors that are early warning signs of schizophrenia include hearing or seeing something that isn't there, a constant feeling of being watched, or peculiar or nonsensical way of speaking or writing, strange body positioning. Now, the symptoms of schizophrenia. A medical or mental health professional may use the following terms when discussing the symptoms of schizophrenia. First, positive symptoms are disturbances that are added to the person's personality. Second, delusions or false ideas. Third, hallucinations. And fourth, disordered thinking and speech. Fifth one is disorganized behavior. Negative symptoms are capabilities that are lost from the person's personality. Social withdrawal, lack of drive or initiative, emotional flatness. Now its diagnosis. Schizophrenia is diagnosed based on criteria in either the American Psychiatric Association's 5th edition of the Diagnostic and Statistical Manual of Mental Disorder, that is DSM-5, or the World Health Organization International Statistical Classification of Disease and Related Health Problems, that is ICD-10. These criteria use the self-reported experiences of the person and reported abnormalities in behavior, followed by a clinical assessment by a mental health professional. Symptoms associated with schizophrenia occur along a continuum in the population and must reach a certain severity before a diagnosis is made. Now its subtypes. With the publication of DSM-5, the APA removed all sub-classifications of schizophrenia. The 5 sub-classifications include in DSM-4 were paranoid type, in which delusions or auditory hallucinations are present, but thought disorder, disorganized behavior, or affective flattening are not. Delusions are persecutory or grandiose, but in addition to these, other themes such as jealousy, religiosity, or somatization may also be present. Second, disorganized type, which is also named herbophrenic schizophrenia in the ICD, where thought disorder and flat affect are present together. Third type is catatonic type. The subject may be almost immobile or exhibit agitated, purposeless movement. Symptoms can include catatonic stupor and waxy flexibility. Fourth is undifferentiated type. Psychotic symptoms are present, but the criteria for paranoid, disorganized or catatonic types have not been met. And fifth one is residual type, where positive symptoms are present at a low intensity only. The ICD-10 defines 2 additional subtypes. First is post-schizophrenic depression. A depressive episode arises in the aftermath of a schizophrenic illness, where some low-level schizophrenic symptoms may still be present. Second is simple schizophrenia, insidious and progressive development of prominent negative symptoms with no history of psychotic episodes. Differential diagnosis. Psychotic symptoms may be present in several other mental disorders, including bipolar disorder, borderline personality disorder, drug intoxication, and drug-induced psychosis. Schizotypal personality disorder has symptoms that are similar but less severe than those of schizophrenia. Schizophrenia occurs along with obsessive compulsive disorder called OCD considerably more often than could be explained by chance. although it can be difficult to distinguish obsessions that occur in the OCD from the delusions of schizophrenia. A more general medical and neurological examination may be needed to rule out medical illness, which may rarely produce psychotic schizophrenia-like symptoms such as metabolic disturbance, systemic infection, syphilis, HIV infection, epilepsy, limbic encephalitis, and brain lesions. Stroke, multiple sclerosis, hyperthyroidism, hypothyroidism, and dementias such as Alzheimer's disease, Huntington's disease, frontotemporal dementia, and Lewy body dementia may also be associated with schizophrenia-like psychotic symptoms. Now coming to the last disease, which is Parkinson's infertility. The association of Parkinson's disease with infertility seems to be incidental. The pathogenesis of Parkinson's disease is due to the loss of dopaminergic neurons in substantia nigra, which does not directly or indirectly contribute to infertility. There are no known contradictions of ovarian stimulation in such patients. The scant existing data suggest minimal effect of Parkinson's disease on pregnancy, childbirth, and neonatal health. There are studies that suggest a possible risk of motor symptoms worsening in connection with pregnancy, probably due to multiple influence of sex hormones, estrogens in particular, on basal ganglia function. All the prescribed anti-Parkinsonian drugs belong to Category C by Food and Drug Administration USA. Previous studies in the literature suggest that there is no or minimal effect of Parkinson's disease on the pregnancy and the fetus, and similar observation was noted in our patient. Parkinson's disease is rare in young women of reproductive age, and no record of successful IVF pregnancy in such patients has been found in the survey of literature. The major issues in such patients are mainly the effect of ovulation, induction, and pregnancy on the disease, as well as the safety of medication to the fetus during pregnancy and lactation. The pathogenesis of Parkinson's disease is mainly due to genetic susceptibility to environmental toxins leading to focal dopamine depletion. Parkinson's disease is usually thought as a disease of the elderly. Approximately 3 to 5% of women diagnosed with this disorder are under the age of 50. A large number of these women are still experiencing regular menstrual cycles. Studies that have revived the effect of hormone fluctuations and menstruation on Parkinson's disease have noted an impact of the menstrual cycle on disease control. They also complain of increased fatigue, cramps, and heavier menstrual flow. This can lead to occasional humiliating self-care issues due to worsening dexterity. Now the major symptoms. The major symptoms of Parkinson's disease are tremor, rigidity, akinesia or bradykinesia, postural instability. Other motor symptoms include gait, dystonia, hypophonia. Primary known causes of Parkinson's disease is idiopathic, that's in majority of cases, drug-induced calcium channel blockers, and toxins supported by the geographically varied incidence. Now the pathophysiology. The specific region affected seems to be the pars compacta in the substantia nigra, where there is a marked loss in dopaminergic cells. We also see a considerably high activity in the cells of the subthalamic nucleus, which inhibits movement. High presence of Lewy bodies in dopaminergic cells. Now its diagnosis, PET scan, which is due to decreased dopaminergic activity in the substantia nigra, normal CT and normal MRA. Treatment of Parkinson's disease includes education, exercise, nutrition, and psychiatric counseling. Now the oral medication, which includes L-DOPA, which is the most popular treatment, and the Sinemet, which is made up of levodopa and carbidopa. So this brings us to the end of the lecture. Hope you have enjoyed and understood. Thank you and goodbye.